Welcome to the Veterans Special Programs American National Network, V-SPANN. Our spotlight today shines on Dr. Frank Urasek and the Warrior Healer Program. In the next 30 minutes, we're going to learn about dealing with pain and getting the veterans and their families more involved in their own self-care. Frank Urasek is the chair of the Acupuncture and Oriental Program at National University of Health Sciences in Lombard, Illinois, and attending acupuncturist at Stroger Hospital's pain clinic. Frank has been in practice for 28 years, and for the last 3 years, administering the Self-Care Initiative program at the National University of Health Sciences. Dr. Urasek, welcome back to V-SPANN. It's always a pleasure having you here. And to talk about pain, I found some pain numbers. So here's pain by the numbers. 100 million Americans suffer from chronic pain. 42 million Americans say pain keeps them up a few nights a week. 26 million Americans report frequent back pain. 4.6 hours of productive time are lost by 13% of workers due to pain. And the annual cost of chronic pain and treatments and lost productivity is $635 billion. Pain is a big deal. It's here. And there are two ways of treating this: traditional and ancient medicine. In the past, we've talked about, let's recap, traditional versus ancient.
Yeah, I like to make the distinction between what we know that has shown up for the last 100 years or less, which is conventional, and what has been around, how mankind, men and women, dealt with pain thousands of years ago. And for that, I always like to go back to our friend Otzi, who was named after the Otzal Alps on the border between Italy and Switzerland. And this Iceman was dug out of the ice. He was noticed by a couple of tourists back in 1992 that were hiking up there. And they looked down in the ice, and there was this withered little man that was pulled out, and it was discovered he was a hunter. So here was an individual that, certainly he was in his 40s, had some pain. And the reason they knew that is when they examined this body, they found that he had arthritis of the spine, he had low back pain associated with that, and he had whipworms, which caused him to have abdominal pains. So they did a little more study, and they noticed that this hunter, who was being prevented from hunting and from experiencing life in general by this back pain, chronic back pain, and this chronic abdominal pain, also had some marks tattooed on his body. And they were either 3 lines or 3 lines with a bar through, which in some circles is considered yin and yang. So this is an Italian hunter who was carbon dated, by the way, 5,500 years old, who had the acupuncture or acupressure or acutherapy points tattooed on his body for his back pain and his abdominal pain. And he was dealing with it with these points on his body 5,000 years ago. So we know it goes back even further than that. So he could have done pressure, he could have done heat, he could have done even Venom therapy or anything to stimulate these points to get a reaction to do what? To precipitate the body's natural ability to heal itself. What I like to call the first alternative that we kind of have flipped around here, because we have alternative medicine that is used after conventional care in most cases fails.
The notion of acupuncture that dates back to the Chinese. Just as a point of history, we talked at one point in an earlier program that warriors in China who principally fought with bows and arrows, who went into combat with pain and problems that were wounded with arrows. It was found that their pain went away as a result of that. So, ergo, the development of acupuncture. How has that taken root over the last 4,000 years?
I'll tell you another story directly related to, two more stories directly related to that. So one of the masters that I studied with from Shenyang College in China, their symbol is the rabbit. And the story about the rabbit is that the rabbit, when the rabbit got sick, he would throw himself in brambles, and he would have the thorns treat him for his pain or her pain. The famous classical picture is of a famous general with an arrow through his arm, and he's getting acupuncture done for the pain before they take the arrow out of his arm. So you have this association that the Latin term is ubi venatum et curatum. Where there is poison, there is the cure, which will be setting us up for that principle a little bit later today. So people, of course, when there's not surgery available, as there wasn't 2,000 or 3,000 years ago, when there's not drugs available, when there are not X-rays available, when there were not was not blood work, what did they do? And the interesting thing is what they did is still being done in China in the hospitals. They listened to the pulse, which told them how the energy and blood was going through the organs of the body that the acupuncture meridians were named after. They looked at the tongue, which is divided into 3 areas, which told them what was happening in the lungs and the heart, what was happening in the stomach and spleen, and what was happening in the kidneys. They listened and they looked. They did the 4 examinations. They listened, they looked, they asked, and they touched to get a diagnosis, and they worked from there.
This is a challenge to conventional wisdom that says if something hurts on you, if you have pain, you go to the source of where it hurts and try to fix that, when really the acupuncture, acupressure is a process of interrupting the pain.
I would actually flip that. I would say that drugs suppress pain. They take the batteries out of the smoke detector, whereas in Chinese medicine we have something called Ben Biao. We deal with the branches, which are the symptoms, but Ben Biao roots, you have to deal with the roots that are causing the symptoms. If you don't deal with both, then you continue to have ongoing symptoms, ongoing pain, because you haven't gone to source. So I had a gentleman, a veteran of Afghanistan, first-time patient in my clinic today, and he has chronic sinus pain. In Chinese medicine, the sinuses and the nose are the opening to the lungs. So I did acupressure points. They're actually, some of them are killing points and paralyzing points on the face. Just used the tip of my thumbs. And then I went to the tip of his finger and showed him how he can treat himself from the homunculus, from the microsystem of the finger. And just with those 2 simple exercises in showing him how to, because he can hit these points on his, and these are all killing or healing points. And in a matter of minutes, pain was gone. He could breathe through both nostrils. And the last point on the chest that opens the lungs that I showed him was here, but on the hand it's here. And I showed him how to press that point, because and that's a major difference. We can't do surgery on ourselves. We can't write ourselves a script and go to the drugstore to fill it. We can make our own medicine, though. That tradition has been passed down since ancient times to show people how they can intervene early and have resolution of their symptoms and their causes.
Don't try this at home unless you know what you're doing. And that's what we're here about. The whole purpose of our V-SPANN program is to educate you on different approaches that you can take as a returning veteran or a member of a veteran's family. You're listening to V-SPAN, you're watching V-SPAN, and we're talking about alternative approaches to traditional medicine. And when we return, we're going to meet a patient that has reaped the miraculous benefits of what Dr. Urasek referred to as Venom acupuncture therapy. It's an incredible story, and you're going to hear it on V-SPAN.
Hi, I'm Ernie Scatton, Education Director here at Illinois Center for Broadcasting, the downtown campus. And I am also a U.S. Navy veteran. I served in the Navy from 1987 until 1991, and it was 4 of the best years of my life. They made me grow up, and they allowed me to do things that I normally wouldn't have been able to do, and they let me tap potential that I didn't know I had. But knowing that I had something to do with defending this nation or giving back to a place that has given so much to me and my family, it made me feel good. One day as I was on my way to work, I heard a commercial saying, if you want to be on the air, go to Illinois Center for Broadcasting. And I said yes. I called that day, I went that night for my test, and I passed, and in a week I was in school. I've never looked back. I walked out of school into a 50,000 watt station, ESPN 1000 here in Chicago, and I didn't leave for 9 years. I owe all that to ICB. You know, I guess to sum it all up, the Navy prepared me for life, but ICB prepared me for my future and what I have now, my future in broadcasting.
V-SPAN is a network designed to serve the American veteran. Its mission is to inform, inspire, enlighten, honor, remember, and entertain. Soldiers and veterans will not ask for our help, but it needs to be given nevertheless. Winston Churchill once said, "Never in the field of human conflict was so much owed by so many to so few." This sentiment stands true today.
Veterans deserve this. We owe them, not the other way around.
It's time to pay back our debt to our soldiers and our veterans. It's time for V-SPAN.
V-SPAN, the American Veterans Communications Network. Our V-SPAN spotlight is on self-healing methods utilizing the natural healing sciences. Here to tell us about their incredible experience with Venom acupuncture therapy are Jim and Janet Hamaker. Jim is a Vietnam veteran who was diagnosed 12 years ago with Parkinson's disease. Jim and Janet, welcome to V-SPAN.
Thank you.
Thank you.
We're proud to have you here. Just as a point of reference, Agent Orange has not officially been linked to causing Parkinson's, but coincidentally, the veterans who were exposed to Agent Orange, many of them have developed neurological deficit disorders like Parkinson's and MS. Jim, when you returned from Vietnam, what was the period of time before symptoms of Parkinson's started to develop?
Well, I got back from Vietnam in 1970, and I'd say it probably was in the 80s, late 80s, that I noticed it. And of course what I noticed was, which my leg get to shaking or my arm would get to shaking, and also my face, my wife said I was just like I was drawn, you know, just staring. And then the other thing, my walk, I was walking forward. That was one of the, that's when I came to Dr. Frank, because he wanted to know what was wrong. And I said, well, I want to try to get so I can walk right again. So that was another indicator.
Now, you lived with Parkinson's. You were diagnosed with Parkinson's disease. And how long did you live with that before visiting Dr. Urasek?
Yeah, probably at least 12 years.
It being a debilitating disease caused you to withdraw and not be able to do things that you used to do.
Right. I had a lot of things that I couldn't do, and a lot of my body parts weren't functioning. Once I got to Dr. Frank, we started doing some acupuncture, and then he talked about the possibility of doing these things, with the Venom. And I think, I know we done I don't want to call it an agility test, or, you know, weights and walking and standing, and in a 2-week period of time, he couldn't believe, and neither could the gals, how much I had changed for the better. I was able to do things, well, I could reach down and touch my toes, which I couldn't do when I first went in there on that. And my walk was better. My wife has always said that my walk, I got to swing them arms. Well, if I went down that hallway, I better swing them arms, or somebody's going to make sure I do. But we started, and then the first time we went, one bee sting just to see that I wasn't allergic, you know, to the bee stings. And then we gradually worked up. Well, we're up to 12 now.
Now, Jim, prior to visiting Dr. Frank with this miraculous result, did you undergo any other forms of treatment?
Mm-hmm.
Yeah. What do we call it?
He went to Mayo's.
Yeah.
First of all, we went to Rockford, and this was right after we had lost our son too, and I think that brought it on a little bit more with being just nerves and anxiety and everything else that brought it on a little bit more. So we went to Rockford first, and then they sent us to Mayo's, and they started giving him pills. What were they, honey?
Mirapex and cardadopa, Cinemet.
And the medicinal treatment continued for how long, Janet?
Well, then it went till about 12 years, yeah. And a lot of people did not know that he had it. He's the type of a guy that would push on regardless if he had something or not. And so he was busy with his work and everything, but as a wife, I could see that he was going downhill slowly, and especially with his expressions, when before he was a happy-go-lucky guy and would smile, and then pretty soon his face was freezing and different things. He was slowing down, and so when he was trying to get up out of the bed, he would sit at the side of the bed and then take several times to get up, you know, and then when he got up, he kind of just stood there because he couldn't get himself going. Or there was times that he would look at me to finish his sentence, or, you know, help him to continue the thought process. So, and then the door was open, and the good Lord opened the door. We found the doctor, and now I see him turning around 40%.
It's a remarkable story. The things that you gave up included hunting, one of your favorite pastimes, and we should mention that you're from Lamoille, Illinois,
Yes.
a very rural part of the state. And would it be fair to say that frustration was a factor of it, taking medication for as long as you did, and instead of improving, it was getting worse?
Going the other way.
And he was bound determined he was not going to take any more. He did not want to take any more medicine.
Now, how, at this point, did you even consider an ancient therapy that would have been linked to acupressure, acupuncture, and let alone getting into something much different than you may have even heard about before?
No, I had never thought about that. I mean, I figured what I had, and I was going to have to live with it. But a good friend of mine that had been to see Dr. Frank had told me about what he could do for him, and I said, well, I'm going to give it a try. Because, in fact, the day that I found out about him, my wife was had to get an eye examination because she had a spot on her retina. And that day I was in there, I called up to his office and told him who I was, and they said, well, can you be here at 10:30? Well, I said, I'm about 2 hours away from you. I can't, but I can later on. So he said, what about this afternoon? So I went up that afternoon, and that's when it started, and today this is where we're at.
It is
And
indeed.
thank God that I found him.
Indeed, indeed, a remarkable story. And when we return in about a minute or so, you're going to see a demonstration of how to administer the Self-Care Warrior Healer program, allowing you to take charge of your health. This is V-SPANN.
It is the soldier, not the reporter, who has given us freedom of the press. It is the soldier, not the poet, who has given us freedom of speech. It is the soldier, not the organizer, who gave us the freedom to demonstrate. It is the soldier who salutes the flag, who serves beneath the flag, and whose coffin is draped by the flag. Imagine an America where the ongoing news and events of our troops on battlegrounds in Iraq, Afghanistan, and war-torn areas are followed as closely as the exploits of Hollywood starlets, where courageous fighting men and women receive the media and attention given to overpaid celebrities, where Purple Heart ceremonies receive the honor and acclaim accorded Hollywood Awards ceremonies, where the real-life struggles of military spouses are given more credence than the frivolous lives of real housewives. Now imagine an America where veterans, past and present, are given their proper recognition. A means for this country to show appreciation and gratitude for the sacrifice of veterans. Imagine a TV network that brings us closer to realizing this vision of a better America.
V-SPANN will be the common bond that brings all the veteran community together. What V-SPANN will do will be take all the veteran organizations and bring them under one umbrella, one roof. It will provide them with all the programming and all the help that's out there for each program. And there, we have jobs. The American Legion has all their programs. The VFW has their programs. The Disabled Vets. Then there's so many grassroots organizations. The biggest problem they all simultaneously experience is nobody knows they're there.
The mission of V-SPANN is to raise awareness of and appreciation for all American armed forces, past and present. To the vet, V-SPANN will provide programming that aims to uplift and support and direct them to resources and organizations to help in their battles here at home. V-SPANN will help bring awareness to critical and alarming issues affecting our troops and give soldiers returning from war the moral and psychological support they need. Through acclaimed documentaries and movies, V-SPANN will also help our nation remember its veterans. V-SPANN is a network designed to serve the American veteran. Its mission is to inform, inspire, enlighten, honor, remember, and entertain. Soldiers and veterans will not ask for our help, but it needs to be given nevertheless. Winston Churchill once said, "Never in the field of human conflict was so much owed by so many to so few." This sentiment stands true today.
Veterans deserve this. We owe them, not the other way around.
It's time to pay back our debt to our soldiers and our veterans. It's time for V-SPANN.
V-SPANN, the Veterans Communications Network. This is the Veteran Special Program, American National Network. Our V-SPANN Spotlight today is on the Warrior Healer program of self-care. We've been talking with Dr. Frank Jurasek, and we've hit on acupuncture, acupressure, and now on Venom acupuncture therapy. Our guests are Janet and Jim Hamaker, and the Venom therapy is a miraculous approach to treating what could have been a lifelong debilitating disease, Parkinson's.
Mm-hmm. Yes.
Janet, you've been administering this therapy for how long?
Since probably September, middle of September.
This is a very short period of time for
Yes.
something that Jim has lived with for 20 years.
Yes, yes.
The bee that you have, where did the bee come from? Dr. Jurasek has marked a point that is not the point. It's one of many points, but one of the largest points. We marked the point. what point is marked on Jim's arm?
That's for the large intestines. It's the pressure point for that. And so when I get the bees, they come like this, and you get them out. And so I will just move this right over here, put this bee right here, and he will, if he gets a little mad, he will give him a good sting. Did he give you?
Yeah, I think so.
Okay. He got
No.
him.
Did you get me?
He didn't get you yet?
Yeah.
Oh, I think he did, huh? Right there, I
No,
think. He didn't?
No.
All right, we'll get him. Sometimes they're stubborn. There he did. He got you. And then the little stinger will go into there, and it'll take 4 minutes for that little venom to be pumped in there. And when this little bee here will die because he's lost his stinger, so I just usually just put him aside. And then we will wait 4 minutes here for this venom to go into this pressure point, and then I will just wipe it away. And then instantly it usually just gets red and white, and you can see the venom in there working. And then Saturday I have given him 12 bites on his back and his spine, and instantly they were just really red. And 2 hours later they were nothing but just a little point where they had stung him. So his body is working well with it.
Now, you are giving these treatments 12 times over the course of the day?
No, we do it right away. We do it all at once. And it'll take me about a half hour to do it. And then that might be on Tuesday, and then on Saturday, doctor will call me again and tell me where pressure points. I have a little book that I can look into, and he tells me the pressure point. I'll look and find out where the pressure point is, and I'll mark it, and then we'll do it again. And so I guess you can call me Miss Queen Bee. I don't know.
Well, you know the buzz on
Yeah,
the
right.
bees, that's for sure. It's a remarkable story. The most remarkable, well, there's many remarkable things, but the fact that you're doing this vis-a-vis a phone call,
Yeah.
not an office visit,
When
and you're
he-
administering the treatment,
Yes.
not having to go anywhere.
When he told me that it would be up to me to do it, I just gulped at the time. And then this peace come over me and said, Janet, that's all right, and do it. If this will make him have the quality of life that we can do, and I can do it without medicine, let's do it. And from then on, I haven't been scared of them. They get out and fly around my head. He's worried about them, but if I get stung, I get stung. But I haven't yet. So, but yes. And the thing that has really come around is his smile.
And that's everything.
Yep, it is.
And to close out the show, Jim, I need you to tell us about your desire to get back out and hunting. And just a while ago, after starting this therapy, going from virtually paralyzed, immobile, to South Dakota.
Yes, I went to South Dakota, had several people that went with me, and I guess I surprised myself because, you know, when you ride out there, it's a long trip, sitting in one spot. But when I got out there, we got all ready to go, and I went out in the fields and I walked a lot of them, cornfields, walked some with high brush in it, some I pointed, went to the ends and set, but we came home with our limit of pheasants, and that was a big thing for me. That's a positive note to be able to do that. And plus this year I got a deer, I got a doe in first gun season. I also bow and arrow hunt because Dr. Frank has been so good to call and check to see how I reacted to the bee stings. And call, you might find me in the cornfield, or might find me in the deer stand, or, well, I don't crawl up in the trees anymore. Just on the ground. I got some ground blinds. But how many times he caught me, I don't know, out hunting. But I love to hunt, I love to fish. Well, in fact, I think he even caught me fishing too.
There was one thing I have to add. When he come back from pheasant hunting, he came in and he was very stiff, and he just looked at me and he said, "Honey, I need the bees."
An incredible story.
Yeah.
A miraculous story. And it's something you may not have thought about, but it's here. And now you know about it because of V-SPANN. Our V-SPANN Spotlight was on the self-administered Warrior Healer program. Thanks to our guests, Dr. Frank Urasek and Jim and Janet Hamaker. For more information about the Warrior Healer program, contact Dr. Frank Urasek at www.acuworks.com. This program was made possible through the studios and future broadcast professionals at the Illinois Center for Broadcasting Lombard campus, where broadcasting careers begin. Visit beonair.com for more information about a career on radio and TV. You're watching the Veteran Special Programs, American National Network. This is V-SPANN.